Wednesday morning. I'm being joined now by Watford's Member of Parliament, Dean Russell. Dean, good morning. Welcome to the show.
Good morning, Miles. It's always good to be on.
Yeah, we need to talk today about testing because the country is in what's been described as a crisis when it comes to testing. People aren't being able to get tested when they need to get tested. What are your thoughts on this at the moment? Because it feels like we've just come through a government crisis when it came to exams, and we're going straight into another one. It's not looking good at the moment, is it?
Well, I think the challenge at the moment, and I totally understand the concerns people have, I really do, and thankfully it's only been a handful of people who've reached out to me in Watford with regards not being able to get a test at the moment, and we're trying to do everything we can as a team to help with that, literally going on the booking systems ourselves to try and help them. But as a country, we've conducted about 19.2 million tests, and the closest to us in Europe is Germany with 13.4 million.
But the problem is people still aren't able to get tested, and we've been told that we can go back to work, and we've been encouraged to go back to work, encouraged to play sport, and encouraged to get into restaurants and go back to the gym and do all these things, but the infrastructure doesn't seem to be there. It doesn't matter how many people have been tested. There's a lot of people that aren't able to get tests and aren't able to go back to work and aren't able to go back to school.
Absolutely, and I think that the challenge at the moment is making sure we clear the backlog. What happened over the past few weeks, as I understand it, and believe me, I've been raising this directly with Matt Hancock and with the team, is that there's an awful lot of people, and I'm not trying to blame them for doing it because I understand it, but there's an awful lot of people without any symptoms who in quite a short period of time, en masse, booked in for tests, and what that meant was people then who had symptoms were then mixed into that and not able to get tests. So at the moment, as I understand it, the backlog's being cleared within the laboratories, so the tests are there, but then the laboratories are then having to do those tests.
But at the same time,
clearing that backlog so that they can start testing again.
At the same time, we have been told if we have a doubt, we have to get a test, and for people, if mentally they feel like, I could have this, that they're going to want to get tested to be safe.
No, I understand that, and I think that the point at the moment is that really to focus on people who've got symptoms, or they've got a doubt which is a symptom, not a doubt as in potentially I could have it or I couldn't, but have no real logical reason why they would think that.
What if they've been in contact with somebody who's had a symptom, or if they feel like someone they know who maybe's been in contact with someone who's had a symptom? You say people without symptoms. Do you know that there are so many different parameters to this that we're being told we need to get tested if we have a doubt, and people are so scared of this virus, which is rightfully so, that they're going to want to get tested just in case.
Absolutely, and I understand that. And the point at the moment is we're saying to people, especially if they're in doubt, but they've been in contact with someone through the track and trace system, where they've been alerted, that absolutely they should get a test, and they should try to. And we're not trying to stop people having tests. We've just had an unprecedented rise in a very short period of time of a lot of people wanting tests, but many of which don't necessarily have a specific reason other than a concern that they want to get a test. And so what I'm saying is that for those who have symptoms, focus on those to get tested at the moment. Those who don't have any symptoms and have no real reason other than a general concern, would let people who've got concerns real concerns book the tests at the moment. But the reality is the backlog is being cleared, and I will keep fighting for Watford to make sure that we're getting the testing systems up and running as fast as possible to enable people to get those. But it's not a case that the testing system has broken and that we haven't got tests. It's that the laboratories at the moment are just trying to churn through all the backlog of tests because there's just an unprecedented rise, and I know from the team that they're doing everything that they can to make sure that this is back up and running.
In terms of just quickly, Dean, in terms of people who you say people going to get tested who don't need to, according to the Daily Mail, Matt Hancock's thoughts are that GPs could become almost the authority on this, saying whether people need to get a test or not. Is that actually feasible, or is that going to put too much pressure on GPs, and are people that are going in for stuff that aren't related to coronavirus then going to find that they can't get treated?
Well, I'd be very supportive of that, and I know a lot of GPs, because I speak to all the health professionals regularly, and also, of course, I'm on the Health and Social Care Select Committee, so it's something that I'm very, very aware of. I'd be very supportive of that. I think there was a concern, especially during the height of the pandemic, that GPs already had enough on them, enough challenges, and there was a lot of telemedicine going on, so remote appointments, which I don't think there was a wish, my understanding of it at least, was that I don't think there was a wish to put extra burden on GPs, but also not to get people with symptoms to go into GP surgeries and potentially risk spreading it to get a test. So that's why there was a lot of remote testing and these testing centres. But I think as we move forward, of course, those models need to shift and change. And I think, from GPs I've spoken to and GP representatives, I think they'd be very happy to be able to book tests and to be able to arrange them. But at the moment, obviously, it sounds like that's very much in discussion. And I'd love to hear from GPs in Watford if they want to reach out to me to share their views on that as well. But I'd be very supportive of it from everything that I've heard so far. And similarly, actually, if you don't mind, similarly, pharmacists as well, because pharmacists have been amazing during this pandemic, and they do so much in the community. So again, I've been very supportive of them publicly, and I'd be very much keen to help them be able to do that as well.
I want to talk about face coverings as well, because we are encouraged to wear them on public transport and in shops. I'm still seeing a lot of people not wearing them. Is there something you need to say in regards to that? Is there a message you can give to us?
Yes, please, and thank you for raising it. I'm hearing that, especially in places like the Inn 2, sadly, staff and the guards in there are getting quite a bit of abuse from people who, when they're being asked to put their masks on. The reality is, it's not like New York. New York, it's mandatory, it's law to wear a face mask everywhere. What we're asking is just people to wear face masks in stores and in shops, and I think it's really unfair to be abusive towards staff who are just trying to look after one's health. And so please, when you're going into, to anyone listening, I appreciate not everyone likes wearing a mask and not everyone wants to wear a mask, but what I would say is it's there to protect your health, to protect those around you, but also it's the job of those guys in places like the Inn 2 to safeguard you and other customers and the staff that work there.
Should it become mandatory? Just so people just have to wear them. Should it become mandatory?
I think it's something that has to be constantly under review, but I think at the moment it isn't, and it doesn't need to be right now. But I think, the Great British public have been amazing throughout this pandemic. In Watford, I think we've been exemplary, actually, I think, the community here. So I hope it doesn't have to be, but I think, it's there for a reason. Again, because I'm on the Health and Social Care Select Committee, I see the data and the stats every week on what's going on. And I think, the key thing is just wear a mask, wear a face covering, and but please don't be abusive to those who are in place to try and safeguard you, and don't be abusive to them because they're just trying to look after you and others around you. It's their job, so please be mindful of that when you're walking into the Inn. Put a face covering on. It's not that big a deal. I appreciate not everyone wants to wear one, and if you've got a health reason why you can't, absolutely fine, but don't be abusive to people who are just trying to look after you.
And just quickly before we finish, we've got about 30 seconds. Your mental health first aider launch. Tell us a little bit about that quickly to finish on something a bit more positive.
Yeah, absolutely. So we're launching this very, very soon. I've been working with the Chamber of Conscience, or Chamber of Commerce, but they call themselves the Chamber of Conscience, to launch this. And so people will soon be able to register to get on a list to be a mental health first aider, which we're hoping to have 1,000 over the coming years across Watford. And it's a really big effort that I'm trying to do at the moment, and campaign working with so many different groups across Watford. So please check out my website, deanrussell.co.uk, in the coming days, and we'll have an announcement on there as well as on the Chamber of Commerce as well.
Dean, always a pleasure. Thank you so much for joining us today. We'll chat to you again soon.